we're really excited about the upcoming sessions. It's always a little, the last few years we've swapped from holding all of the sessions in the month of October, play on words that Val came up with, that we continued into November, mainly because of conflict, a lot going on in October, both internally and externally. We find we like to promote our partners' sessions, and we also find Global Ergonomics Month and so many other events in October that November, being Lung Month, really fit well with our webinar series, trying to showcase occupational illness and disease prevention throughout the system partners. So we have a great, maybe Jen, we can scroll up. We have a great few weeks coming for you where, and our theme this year is worker-focused science and prevention. So today we're going to be kicking off with a welcome address from Dr. Joel Moody, our Chief Prevention Officer, who was here a year ago when he just started. And it's exciting to see. And then we're intending to show you, some of what the system has been up to. Lots of exciting news to share with that collective impact that we've been able to make with the Occ Illness Steering Committee and the Ministry and all of the occupational health and safety system partners. Next week we have diesel exhaust exposure influencing change. So we're going to have our own Dr. Kevin Hedges, also Crosh, and USW talking about the diesel particulate project. Following that, we'll have some Dr. Hugh Davies speaking on November 10th with cytotoxin exposure in cancer care, along with we've really tried to influence and have at the forefront the worker's voice throughout all these sessions. And today didn't quite work out, so sneak information that you might get out early today, but no, don't worry, we still will have that worker giving us the user experience with the SIlica Control Tool, but he's going to join us at Worker and Workplace on November the 24th. So we have Unifor talking about some cytotoxin concerns in their long-term care facilities, November 10th, and also our nail salon project work through the public and community health care centers. November 17th, we have OCRC, the Occupational Cancer Research Center, along with OHCOW. We also have some folks, we're talking collaborations provincially, nationally, and all the way to internationally. We have the International Firefighters Association speaking along with IARC and Health Canada with some work on that date. And then closing out on November 24th with making it all easier for everyone. So knowledge mobilization and tools is what this session is all about. And how can we get you being part of this system and this very important focus of occupational illness prevention. So welcome, everyone. I hope you can join us throughout November. And without further ado, Jennifer, I wonder if you might share Dr. Moody's welcome words.
Hello, everyone, and thank you for joining. It's an honor to be here with you once again this year to open up this webinar series. Last year at this time, I was very new to the role of CPO, but of course, a year can go by very quickly, and we're back here today. Having worked and done research in occupational disease before stepping into the role of CPO, I especially look forward to seeing this event occur each year. This symposium is a great way for all of us to share tools relating to the latest science and prevention initiatives, hear updates from colleagues, and to build connections. The latter of which I've had a great and tremendous opportunity to do so since I've taken over the role of CPO. Everyone joining us today is well aware of the ministry's commitment to the health and safety system. From the development of the Occupational Disease Action Plan approximately 5 years ago to the implementation of our current prevention work strategy, preventing occupational illness disease is a key area of focus. And as a system, we're working together on important initiatives, such as items related to silica exposure. A lot has happened since we last spoke, especially when it comes to occupational disease prevention. We've launched an occupational illness system review that will evaluate how occupational illnesses in Ontario are identified, monitored, and prevented. We've reaffirmed and went further with our commitment to funding occupational cancer research. And of course, we've gone through another year of supporting workplaces with guidance and resources to manage the workforces as the COVID-19 pandemic continues to evolve. We remain committed. Throughout this series, there are some amazing presentations from leading researchers on important topics. So I want to thank OHCOW and all those involved in putting this together. This is a great event that we need to continue each year and continue to share and build awareness of the importance of occupational disease prevention. I want to say thank you and enjoy the webinars.
Thanks, Jennifer. That's great. And I don't know about you folks, but it's been quite motivating, really, to have this, U.S. born with an undergraduate degree in civil and environmental engineering, and then studying health at national health and epidemiology, and even biostatistics and epi, and a medical doctor with cancer epidemiology leading us. He spoke to our physicians and has our board as well, and it's really inspiring and motivating to have the understanding of what we're doing. So with Jennifer, I'll get you to switch to the slides for our next speaker, and I'll share some housekeeping items as well that I didn't. Just if you have questions, we are going to hold those until this section is completed. But you're welcome to throw them in the chat window, and we will moderate them as we go. So our next set of speakers are Fiona MacPate, the Provincial Specialist, and you're welcome to come on camera as I introduce you folks, so people have a face with the names. And Fiona is, oh, sorry, I just had a heavy reading week son home from school distraction, so bear with me. Fiona joined the Ministry of Labour, Immigration, Training and Skills Development in 2009 as a healthcare provincial specialist. Prior to joining the ministry, Fiona had over 20 years of work experience in the healthcare sector, working at a large GTA hospital, managing an infertility lab, and later as a health and safety consultant with the Healthcare Safety Association. In 2012, she joined the Industrial and Safety Program at the ministry as a provincial specialist. In this role, she supports and develops guidance for internal stakeholders, from inspectors to the Minister's office, on provincial health and safety matters. She also provides information and guidance on workplace parties and the public through her role on various committees and through the ministry correspondence and resources. When she's not working, weather permitting, it's a good thing we found her today because she's on the golf course, and quite a day for it. We also have Jennifer Stanley. JJ is a Bachelor of Science in Toxicology from the University of Guelph and a Master's of Science applied in Occupational Health from McGill, fellow alumni university. She's a Canadian registered safety professional and a registered occupational hygienist. Prior to joining the Ontario Public Service in 2013, JJ applied her education and training as an occupational health and safety consultant, a toxicologist, and a biosafety officer. JJ is currently a provincial specialist for the healthcare health and safety program at the Ministry of Labour, Immigration and Training Skills Development. That's just becoming a mouthful for all of us. It's MOL out there, but it's the Ministry of Labour, Immigration, Training and Skills Development. And then we have Scott Secord, who is Provincial Specialist, Mining Health and Safety Program, Ministry of Labour, Immigration, Training and Skills Development. And Scott joined the ministry in 2021. Prior to joining, Scott had about 15 years of experience in the mining sector, ranging from exploration and diamond drilling camps to underground mining and milling. So Scott's a registered professional geoscientist who has focused his efforts on improving health and safety performance through the implementation of health and safety management systems and risk assessment. And finally, we have a video because Cristina couldn't join us in person today. Cristina St. Pierre is the provincial hygienist at the ministry. She leads the group of occupational hygienists within the ministry responsible for the enforcement of the Occupational Health and Safety Act and its regulations. She joined the ministry in 2013 as a hygiene consultant and became the provincial hygienist in early 2022. Prior to joining, Cristina was an occupational hygienist with the Workplace Safety and Insurance Board. She started her career in the nuclear industry and also has experience in private consulting and performing occupational hygiene surveys and laboratory analysis. Cristina has a Master's of Engineering degree in occupational hygiene from U of T and has been a certified industrial hygienist for over 20 years. So welcome, team. They're here to talk to us about the Healthy Worker and Healthy Workplace initiatives, and I'm just so pleased to have them today and all that we're doing on this side of, as you'll hear about next on our kind of strategic plan around enforcement around preventing occupational illness. So welcome.
Thanks, Kim. So I'm going to lead off our group, and I'm just going to go off video while we're presenting just to conserve our bandwidth. Okay, so if you want to go, I'm actually going to, the first few slides, I'm going to be speaking to some of the timeframes and stuff that are applicable to all of our initiatives across the board. And then I'm also going to talk a bit about, you know, the enforcement of the Act and some of the regulations that are also common across the board. And then I'm going to specifically speak to what we're doing in the industrial program with regards to SIlica. And then I'm going to pass it over to JJ, who's going to talk about what's happening in healthcare, and then Scott's going to talk about what's happening in mining. Next slide, please. Okay, and you can go to the next slide, please. So in terms of our initiatives, when will the initiatives occur? So they actually started October the 3rd and will continue until December the 30th with what we refer to as our compliance assistance phase. And the importance of this phase is really, it's about the ministry working with our health and safety system partners. So as Dr. Moody had spoken to, we're working well with our system partners to try to educate workplace parties, make sure that they have the information and resources that they may need to address the hazards that we're looking at during the occupational initiatives. And so part of that actually is things like this, where we've partnered to do webinars. We've also partnered with some of the other safety associations to do, you know, hour-long or more education and awareness sessions, and we'll talk a bit about those as well as we go along and where you can find that information. Our focused inspections actually start on Monday, October the 31st, and they'll run until the end of December. And so during this, you can expect that this is when our inspectors will be coming out to determine whether or not the workplace parties are in compliance with the Occupational Health and Safety Act. When the inspectors come out, they'll introduce themselves. They'll let you know what the purpose of their visit is. And they'll usually ask to be accompanied by a management rep and a worker rep during their inspection. During the inspection, they can also ask for a review of administrative materials such as policies, procedures, records of training, maintenance records, and they'll also be doing a physical inspection of the workplace. And during that inspection as well, they will leave a field visit report. So that's a report that contains their findings. The description of the visit will be contained in their field visit narrative. And if they have any orders, then those orders would be left as well. And a copy of that field visit report is posted in the workplace. One of the things I want to point out specifically because of the OC illness focus is there's a big component as well for some of these with regards to hygiene. So you may find that when our inspectors come out that they're also accompanied by one of our industrial hygienists. So you may have more than one person who comes out to visit the workplace. Okay, next slide, please. Okay, so I'm going to talk a little bit just about some of the areas that are going to be common again across all of our initiatives. So the inspectors are going to be looking at our employers, supervisors, and workers complying with their general duties. So with regards to that, we're looking at the employer duties under Section 25 and 26. So for example, we're looking at things such as, is information, instruction, and training being provided to workers and supervisors? Has equipment been maintained in good condition? Have they taken every precaution reasonable in the circumstances for the protection of workers from the hazard? And there's also a general duty for employers to take every precaution reasonable to protect them from the hazard. One of the things I want to point out as well, because I'll be talking about the designated substance reg, is under section 26, the employer has a duty to establish a medical surveillance program. And I'll talk a bit more about that when I'm covering the initiative on silica. We'll also be looking at, particularly again, where the designated substance reg applies. I think a lot of us are familiar with the need for a joint health and safety committee where there's 20 or more workers. But the requirement also applies at a workplace other than a specified construction project where a designated substance reg applies. And that's very important because when I speak to the designated substance reg with regards to silica, you'll see that there's a lot of need for consultation throughout the processes of assessment and establishing control programs in other areas where the employer is required to consult with the Joint Health and Safety Committee. The other important thing that we're going to be looking at are employers meeting their occupational illness reporting obligations under the Act. So if an employer is advised by a worker or on behalf of a worker that they have an occupational illness, or that a WSIB claim has been filed, then they're required to report that occupational illness to the ministry within 4 days. They're also required to provide a report to the Joint Health and Safety Committee and to the union. I'd like to just point out that the hyperlink there, and you'll be provided a PDF copy of our slides, that will take you to the ministry's reporting page. And so it sets out what the reporting requirements are under the Act. The other thing that we implemented just over the last year or so is a form that the employer can go in. They'll be prompted with regards to the information that has to go into the form to report to the ministry. And then at the end, it'll say, press this button, submit to the ministry, and the form will go directly to our contact center. And then the employer can print a copy of that form and share that with the committee and also with the union if there's a union in the workplace. One of the things that we found in many of our initiatives is we continue to issue orders under the Basic Occupational Health and Safety Awareness Training Reg, so Reg 29713. So I just want to remind everybody of the need to ensure that supervisors and workers have completed that basic occupational health and safety training. And on the ministry's website, we do have free resources for that. So there's a worker book and a supervisor book in order to comply with that requirement. As well, common across a number of our initiatives is looking at the WHMIS reg. So the inspectors will be looking to ensure that there's compliance with WHMIS. So they'll be looking at labels, safety data sheets, and worker education programs. So those are just sort of some of the common areas that we'll be focusing on in all of the initiatives. On the next slides, I'm going to speak specifically to what we'll be looking at in the industrial program. Next slide, please. So in the industrial program, we're focused on crystalline silica. And so as you may know, crystalline silica is found in nature, most commonly as quartz. It's also found in granite and sandstone, in quartzite and other types of rocks and sand. The concern with silica dust is that silica dust particles can become trapped in the lungs, and it could result in permanent lung damage, such as silicosis. And workers could also be exposed and maybe at risk to other diseases, such as COPD and kidney disease. And there's a couple of good studies that support the rationale for why it is that we're focusing on crystalline silica in industrial. So Cancer Care Ontario, and there's a link there to the fuller research report if you have an interest in reviewing that, have reported that each year approximately 200 cases of lung cancer in Ontario are caused by exposure to crystalline silica in workplaces. And it's also the second leading cause of occupational lung cancer after asbestos. There was also a similar study by Carex Canada to support the rationale for the focus of our blitz. And they've reported that approximately 570 lung cancers are due to occupational exposure to crystalline silica each year in Canada. And based on past exposures, and that's about 2.4% of lung cancer cases that are diagnosed annually. Next slide, please. So where are we going to be visiting? So for the industrial program, our inspectors will be visiting workplaces such as factories where they manufacture quartz and granite countertops, concrete, porcelain, ceramic, and other stone products. We're also going to be going into foundries. So the concern in foundries is if they're cleaning castings that may be made from silica sand molds, then they could be potentially at risk of exposure. We'll also be looking at primary metal manufacturing. And then we're looking at other workplaces where they may be exposed, for example, during transportation of products that could contain crystalline silica, or in the storage and warehousing of those products. One of the things that we do recognize for this initiative is that many of these workplaces that we could be going into may be small business or employ vulnerable workers. So we've also partnered with our small business specialists to do some communication on this initiative during Small Business Week. And we've also partnered with the vulnerable workers specialists. We're looking at ways to make sure that the information that we're communicating is getting to the workforce in the format that they need. And we're also looking into potential languages that we should be addressing so that workers are getting the information that they need with regards to the hazards. And OHCOW is actually helping us out with that as well. So inspectors are also going to focus on job tasks in industrial workplaces that put workers at risk of inhaling crystalline silica. So this could be tasks such as the grinding, cutting, sandblasting, crushing, anything that could potentially cause silica to become airborne and therefore inhaled by the worker, and also looking at mixing materials that may contain crystalline silica. The other group of workers that could be exposed, or even it could be the worker who's directly working with silica, is during housekeeping processes. So things such as dry sweeping, the improper handling of HEPA filters or HEPA vacuums, and other dust collection equipment could end up dispersing silica back into the air, and then workers may be exposed. Okay, next slide, please. So in addition to, the compliance with the Act and the WHMIS regs and the awareness reg that I pointed out in the earlier slides, there's a big focus in this particular initiative on the designated substance reg. So the designated substance reg applies with respect to silica to every employer and worker at a workplace, so other than a construction project, where silica is present, produced, processed, used, handled, or stored, and the and is very important, at which a worker is likely to be exposed to silica. Some of the things that then have to be in place with regards to complying with the designated substance reg is that employers have to complete assessments of the exposure or the likelihood of exposure to silica. And again, I had pointed out that even with smaller workplaces, there's a requirement for the Joint Health and Safety Committee. So those assessments have to be conducted in consultation with the Joint Health and Safety Committee. Where required, SIlica control programs have to be implemented, and there's a number of elements that have to be included in those control programs. So the control programs have to include engineering controls. They have to include safe work practices, hygiene facilities and practices. They also have to provide for training programs for supervisors and workers on the health effects of silica and the measures and procedures to follow under the control program. The measures and procedures in the control program as well. So again, the important role of the Joint Health and Safety Committee is that those have to be developed in consultation with the committee. So it's really important that the employer and the committee are meeting together to review the results of the assessment and working together to understand those results of the assessment and then implementing their written control program. It's also important then that employers are also taking all necessary measures to ensure workers' airborne exposure to silica is reduced to the lowest practical level, and in any event, it does not exceed the occupational exposure limit set for silica in the regulation. The control program also has to provide for sampling. So we're looking at ensuring that there are airborne concentrations of silica sampling that's been done and worker exposure, and the records of this air sampling, which is personal air sampling, has to be maintained in the records. Okay, next slide, please. So some additional areas of focus under the reg is where required, the medical surveillance program has to be set up by the employer. So the employer is required under the Act, under Section 26, to establish a medical surveillance program where prescribed. So it is prescribed in the designated substance reg. And it's the employer who's responsible for the costs associated with that medical surveillance program. A worker is not required to participate in the medical surveillance program. It is voluntary for the workers to participate. But I think it's important that as part of the information and instruction on the hazards of silica, that it would be good for the employers to also include information on the medical surveillance program and why it would be of a benefit for the workers to participate. The other thing that's set out in the designated substance reg, and it was recently updated as well while we were all sort of stuck at home during COVID, was there's now a requirement to have a written respiratory protection program in the regulation itself. And workers have to be fit tested, and they have to receive information instruction on the safe care, use, and limitations of their respirators. So there's a whole lot of stuff to sort of absorb with regards to the application of the designated substance reg. The other regulation I want to talk just briefly about is the industrial establishments regulation and how that applies to this particular initiative. So some of the areas the inspectors will be looking at is our work surface being kept clean and free of debris. So again, we know that if there's dust and it's being dispersed into the air, that could potentially expose workers to crystalline silica. We're also focused on the safe material handling of quartz and stone slabs. And the reason for this is something we've been focused on all year round, is we've had a number of critical injuries where there has been workers who have been struck by large slabs of material. So we're going to continue to focus on that. In the regulation, there's also a requirement for eye wash stations and safety showers. And then the inspectors will also be looking at mechanical ventilation, so making sure that the workplace is properly ventilated and that there are no new hazards introduced with return air. So we want to make sure that we're not introducing additional hazards into the workplace. There's also a requirement in our industrial reg for training on the handling, use, and storage of hazardous products, on the use of personal protective equipment, as well as on emergency procedures. And then there's also a requirement, so this would be applicable to, for example, respirators where they're not single-use respirators, for example, is that the personal protective equipment is cleaned prior to it being issued to another worker. So that's a very high-level sort of overview of our initiative for the industrial program. I just want to let you know that some of the links there will take you to our industrial sector compliance plans. You'll be able to find out a bit more about our initiative. The other thing I want to let you know about is we did do a 1-hour education awareness webinar with WSPS. So that webinar is available free online. And so if you're looking for more details on the assessment and the control program, how you go about doing that assessment and setting up your control program, that would be a good video to watch as well. The ministry has a good guide on the designated substances in the workplace reg, and that's available on our website. So it's a plain language guide to explain the regulation. And then the other thing is there's a code for medical surveillance for designated substances. So the requirements for medical surveillance are set out in that code, and that is also available on our ministry website. And I think that's over to JJ. If you go to the next slide, just want to be sure on that. Yep, so JJ, over to you for the healthcare program.
Thank you, Fiona. As you are aware, the Healthy Workers and Healthy Workplaces initiative is happening in many sectors. And in healthcare, we are focusing on awareness and prevention of occupational dermatitis. So inspections for healthcare will focus on exposures and work practices that may result in occupational dermatitis. Next slide. You may be wondering why we chose to focus on occupational dermatitis. It causes a significant lost time injuries in the healthcare sector. it can have impacts on people's work life, obviously, but also in their home lives as well. We also know that this is typically underreported in the healthcare sector, and the true prevalence is not really known, but it is considered a common condition among healthcare workers. There are also conditions such as wet work in healthcare that makes healthcare workers particularly susceptible to occupational dermatitis. And when we talk about wet work is defined as wearing gloves for more than 2 hours per day, or having your hands in a liquid such as water for more than 2 hours a day, or washing hands more than 20 times per day. Next slide. In terms of locations, all healthcare workplaces are included in this initiative. Inspections may focus on areas where there's potential exposure to agents that may result in occupational dermatitis, such as wet work, which we've described, and also work with skin irritants. Irritants are substances that can cause direct damage to skin to anyone exposed to sufficient quantities without the adequate controls in place. And some examples in healthcare include detergents, disinfectants, and hand cleansers. Also having a concentration on work with skin allergens or skin sensitizers. Allergens or sensitizers are substances that can trigger an allergic response in some workers following repeated exposures, after which they become sensitized and can have significant skin reactions even when contacting minute amounts of that particular substance. Some examples in healthcare include formaldehyde, methacrylates, and latex gloves. I want to also highlight that this initiative is not restricted to just workers who are working with patients directly. It can also, inspections can also occur in other areas of the workplace, such as environmental services and dietary services. Next slide. So as Fiona described, the enforcement and compliance under this initiative includes all the things that we talked about under the Occupational Health and Safety Act in terms of the general duties. For workplaces that fall under the healthcare and residential facilities regulation, there are also other relevant provisions, and we'll talk about those on this slide. For example, Section 8 and 9 of the healthcare regulation deal with measures and procedures. So for example, there needs to be measures and procedures for the safe handling of hazardous chemicals, including skin irritants and skin allergens in the workplace. Section 10 of this regulation deals with personal protective equipment, PPE. Workers who are required to use PPE for hand protection need to be trained on when to use it, how to use it, what we call donning and doffing, and how to access it. And this PPE must be stored in a convenient location in the workplace. Next slide. To prepare for this initiative, employers should identify and assess the risks from skin hazards in the workplace, implement controls to reduce workers' exposure to agents that may cause occupational dermatitis, provide education and training, information, and resources, encourage workers to participate in their workplace health and safety program, and follow up to ensure that the preventative measures are working. We've included near the top of this slide a website, a hyperlink to our website that talks a little bit more about this particular initiative in the healthcare sector. And this website also has links to other resources, and those would include the Public Services Health and Safety Association, CREOD, the Center for Research Expertise in Occupational Disease, and Public Health Ontario, recommendations for the prevention, detection, and management of occupational dermatitis in healthcare settings. That's a particularly useful document for workplaces who are looking at their occupational dermatitis prevention program. And with that, I'd like to pass it over to Scott to talk about mining.
Thanks, JJ. This Healthy Workers and Healthy Workplace initiative is actually very, very important to the mining sector in Ontario. And that's because 87% of all the fatalities within the mining sector are actually caused by fatal occupational disease. Between 2011 and 2021, 179 workers actually reported to have died from occupational disease. And sadly, we know this likely represents a lower limit, as often occupational disease with its long latencies is either underreported or not reported at all. And in fact, the Mining Health and Safety Review, which is a complex and sector level deep dive into health and safety in the mining sector, which was conducted in 2015, identified occupational disease as one of their highest risks. I'm going to present to you today a small snippet of a larger presentation that was done with the support of Workplace Safety North, which is the mining sector's health and safety association that was conducted earlier this month. And there's a link below to that webinar, and that goes into details about more information about the initiative, as well as some more background information about why this initiative is so important in the Ontario mining sector. And so there's a link on this page to that, as well as a link to our total mining sector compliance plan, which includes our mobile equipment compliance initiative, as well as our explosives initiatives that we conducted this year. Next slide, please. And so this initiative is really going to focus on 5 key areas in the mining sector. It's ventilation systems, diesel exhausts, mine exposures, designated substances, and WMSs. And so for ventilation systems, for those who may not be aware, in mines, the primary means of diluting or removing contaminants from underground and in some mining plants as well, is through ventilation systems. And so one of the things our inspectors will be checking for is to make sure that ventilation systems, mechanical ventilation systems, are actually operating as designed, especially in areas where diesel equipment is working, making sure that there is enough airflow to actually remove and dilute contaminants as required. And that's because our next item for diesel equipment is, as we all know, diesel emissions can be very toxic and hazardous to workers. And so when you're in a confined work area, such as underground mine, ensuring that diesel equipment is properly maintained and operating as per design is critical. And so our inspectors will be checking into that as well. For mine exposures, inspectors will be checking against exposure limits as set by 833. Regulation 833 that is, and making sure that there's control programs in place where required, and that the Joint Health and Safety Committee is actually supported in these, and that there's plans and measures in place when exposure limits are exceeded. For designated substances, it'll parallel the requirements that Fiona spoke to in the industrial program, and really focusing on silica, arsenic, asbestos, isocyanates, etc. And so this is a really important program. We're going to be checking for, again, that designated substances programs are in place, that there's medical surveillance programs in place, that there is consultation with the Joint Health and Safety Committee, all the good stuff that Fiona spoke about earlier. And lastly, definitely not leastly, is WMS, and we're going to be checking for employee training, hazardous material storage, handling, especially as it relates to disposal and handling of spills. All good stuff there. Next slide, please. So we're going to be taking a look at my favorite regulation in Ontario, which is Regulation 854, which is for mines and mining plants. And in Section 12, it sets out the requirements for the appropriate use of personal protective equipment, which includes respiratory protective equipment. The sections that we call the 180s, or 182 through 187, really deal with the use of diesel-powered equipment. And this makes sure that we have a notice of when diesel-powered equipment is used, that diesel exhaust emissions are less than 600 ppm, requires employers to maintain records and charts of procedures related to where diesel power equipment is being operated. It sets out airflow requirements and the concentrations of diesel exhaust that can be in the workplace. It sets out limits for total and elemental and carbon. Sorry, it sets out the limits for total and elemental carbon. And it sets out the requirements for testing the airflow and testing the quality from diesel-powered equipment. Next slide, please. When we move into the 250s, really this is taking a look at the ventilation systems, and so identifies ventilation systems for mining plants underground. It sets out auxiliary ventilation systems and requirements for non-ventilated areas in mines. It really has a couple detailed sections on where and when you need to use water for dust management underground. And it requires that dust and other material that is likely to cause airborne hazards to be removed quickly and without delay. It includes surveys for assessments and monitoring of hazardous elements and compounds, and sets the requirements for air makeup and recirculated air both underground and in mining plants. And the 280s set out the requirements for monitoring radon emissions. So these are the big components that we'll be taking a look at as our inspectors and our hygienists are attending mines and it's doing their inspections. Next slide, please. Unfortunately, our construction partners couldn't be with us today, but as was mentioned, this is a cross-platform initiative, the Healthy Workers and Healthy Workplaces initiative, and so their focus this year will be on the asbestos hazards, looking at asbestos in construction sites, monitoring the hazards and identifying the controls for those hazards. And they put together a wonderful presentation with the Infrastructure Health and Safety Association, IHSA, that can be viewed at this link that's presented in this video. Thank you. Next slide.
Thanks, Scott. And Jennifer, we can play now the video from Cristina.
Immigration training and skills development. Hi there, I'm Cristina St. Pierre. I'm the Provincial Hygienist with the Ministry of Labor, Immigration Training and Skills Development, and I'm here to talk about our occupational hygiene initiatives. For those of you who don't know what occupational hygiene is, it's actually also called industrial hygiene, and it is the anticipation, recognition, evaluation, and control of workplace hazards with the goal of protecting workers' health and preventing occupational illnesses. There are currently 19 occupational hygienists within the ministry, and we assist health and safety inspectors when they do their workplace inspections and investigations. Our hygiene group had selected a couple of hygiene initiatives for the fiscal year 2022-2023, and these initiatives line up with initiatives that are set by the industries, by the different industry sectors, with the same objective of preventing occupational illnesses. Our first initiative is on respiratory protection, and this is basically enforcing regulations 490 and 833. 490 is the designated substance regulation, and Reg 833 is the control of exposure to biological or chemical agents. Back in 2020, there was a change that was that took into effect with these two regulations, and that was the addition of the respiratory protection program sections that have been included in these regulations. And these sections are basically identical in both regulations. Under these sections, a written respiratory protection program will now be required every time an employer provides a respirator to workers. It doesn't matter if the respirators are to be used on a voluntary basis or mandatory. They will need to have a written respiratory protection program as soon as they give them the respirators. Under this program, there's certain elements that we will be looking for, and this includes a selection of the proper type of respirator that is suitable for the hazard found in the workplace. And the respirator can be a NIOSH approved respirator or equivalent. Equivalent meaning could be a CSA approved respirator, which is now available in the market. We now have a CSA standard that allows us to certify our own respirators the same way that the US NIOSH, US-based NIOSH does. Under the respiratory protection program, we will also be looking to make sure that there is training provided to workers on the care, use, and limitations of the respirators. Workers need to know how to use the respirators, how to put them on, what they should do to maintain the respirators in good condition, and at what conditions or situations the respirators will not be effective. For workplaces that use compressed breathing air, we will also be looking at compliance with the CSA standard Z180.1, which is the standard on compressed breathing air and systems. Depending on what type of compressor is used to provide the breathing air, there will be other requirements such as an inline carbon monoxide monitor for oil lubricated compressors. There may also be a requirement to do breathing air quality testing with parameters that are set out in the CSA standard. Respirator fit testing will also be required for tight-fitting respirators, and the testing should be conducted in accordance with CSA Z94.4, which is a standard on the selection, use, and care of respirators. Under the standard, the fit testing could be qualitative or quantitative. It must be done at least every 2 years or more frequently when there are changes in the worker's health or facial features that would affect the fit of the respirator. And facial hair will not be allowed for workers who wear tight-fitting respirators where the respirator meets the skin. The other initiative we have is the asbestos in building structures, and this is basically enforcement of Reg 278 on any workplace that has asbestos in their building structures. Reg 278 is a designated substance reg on asbestos on construction projects and in buildings and repair operations. And this ties in quite neatly with the construction initiative on asbestos workers register, which takes place just before the hygiene initiative on asbestos. Under this initiative, we'll be looking at an asbestos management plan, making sure that this is in place in workplaces that have asbestos containing materials. Under the plan, there should be an asbestos record listing all the locations of the asbestos containing materials in the building, and this record needs to be updated every 12 months. These materials also need to be inspected regularly, and any materials in poor condition must be removed, repaired, or encapsulated. There is also a requirement in the program to notify occupants, contractors, and workers of the presence of asbestos-containing materials if the materials will potentially impact their work or they could be exposed to it during the course of their work. And workers who work with asbestos or work in situations where they could be exposed to asbestos must also be trained on the hazards of asbestos and the safety measures required to protect them against exposure. And finally, we will be looking at the measures and procedures that are associated with types 1, 2, or 3 asbestos work. Reg 278 is actually quite prescriptive on how you classify the asbestos work as either type 1, 2, or 3, and there are corresponding measures and procedures that need to be followed depending on the classification. These two initiatives are not sector-specific, meaning they apply to any workplace where respirators are used or provided and or where there are asbestos-containing materials present in the building structure. The education outreach and awareness phase had already started back in the beginning of the fiscal year on April 1st and will continue on through March 31st at the end of the fiscal year. The inspection blitz phase will take place between January 4th and March 31st of 2023. And the education outreach has actually been done by our health and safety associations who can also assist you with compliance depending on your industry sector. So there's a specific health and safety association that would be best able to assist you depending on your industry. For example, IHSA, or Infrastructure Health and Safety Association, normally services the construction industry, those involved in electrical work, utilities, aggregates, natural gas, and transportation. PSHSA, or the Public Services Health and Safety Association, helps employers who are under the Ontario's public and broader public sector, and this includes hospitals. WSPS, or Workplace Safety and Prevention Services, assists workplaces involved in manufacturing and those in the agricultural and service sectors. And finally, Workplace Safety North helps industries in mining and forest products and also other businesses across Northern Ontario. In addition to these health and safety associations, we also have a couple of resources on our website, and they are listed on this slide. The first one is a guide to designated substance in the workplace, and this is basically a guide to the Reg 490, which is a designated substance regulation. It includes all the requirements of the regulation, but also the sections on respiratory protection program that, as I've said earlier, is identical to the one in Reg 833. So this guide will also be useful in compliance when it comes to this initiative. The other guide is the one for the regulation respecting asbestos, and this is Reg 278, and it applies not only on construction projects, but really any workplace that has asbestos in their buildings. So this guide will tell you how to comply with any requirements of the initiative as well. So between the Health and Safety Associations and the resources, I hope that you have enough information there to assist you in compliance when it comes to these initiatives. But if you have any questions, just feel free to reach out to us as well at any time. That concludes my presentation. Thank you for watching and listening.
Thanks, Jennifer. And thanks to all our presenters. And we are welcoming questions. Oh, can you hear me okay? Yes. Oh, good. I didn't know if I was on my headset or not. So welcome back. And Cristina, it's funny, she presented also at the Occupational Hygiene Association of Ontario, and we didn't want to make her redo the recording, but she did want to add a couple of things, and one's kind of embarrassing because it's touting us, but you know, she did want to, I put in the links to the Workers' Health and Safety Center as another resource, as well as ourselves, of course, when it comes to some of this hygiene. We have 15 hygienists on staff and are a great resource. And she did also, you know, they talked about volunteer written respiratory protection program and fit testing requirement, even when voluntary, but with the exception of when provided for COVID. So she just did want to mention that you know, that little detail, and she changed both of those when she did the presentation for the Occupational Hygiene Association. So I just wanted to bring that those updates to you. So feel free to write in the chat, or and you know, if time allows, we will most certainly you can unmute and have people ask their questions. So thanks, Kevin, for sharing all of the resources. That's great. It's always nice to have resources in the chat. As Sarah Lovell mentions, should we anticipate a review consultation for the silica exposure limits in the next couple of years?
So I'll take that, but I have a quick response in that I know that the ministry did go out and consult on the OELs for silica in 2019. So the feedback from the consultation is under review at the ministry. So I don't have more than that with regards to the update at this time. Okay.
And Ina covered you for Kevin's question. That is great. Hi, Ina. That's wonderful. And lots of good links in there as well. Kevin's talking about the CSA-Z, but Christina's not here, Kevin. So do you want, I'm not sure anybody would be able to answer your question. If you want to expand on it yourself, go ahead. We can't hear you. Still.
Artificial stone, or engineered stone, as it is called in the US. It's artificial stone in Australia. It's a different beast. It's basically an aggregate of like pulverized quartz, if you like, and they use a polymer to put it together, and it contains more than 90% of crystalline silica, and they're seeing a big resurgence of silicosis both in Australia and also in the US. So, you know, when you do your inspections, really hunt out those really high risk situations. That's the first piece of advice, and you get that. The other was just a question, and I know Christina's not here. It kind of surprises me that with the CSA for respiratory protective equipment, there's sections of it that are cherry picked out and put into the legislation. You know, why wouldn't the whole of the respiratory protection standard be put in the legislation instead of just components? So that was my question. Thanks.
Yeah, and the whole initiative is mainly around the countertop operation, but it's interesting. Kevin and I both attended a couple of conferences recently, and he's put some in the chat that some of the governments are actually covering payment for medical surveillance. Australia has a program, so it's you know, we have these initiatives are so helpful, and if there are any other questions, please please throw them in the chat window, and from folks out there. Is a big group today.
Yeah, I just want to mention,
Hi.
a few years back, we actually did a hazard alert on manufacturing silica countertops, stone, quartzite, that type of thing. And it covers both industrial and it also covers construction. Because we recognize that when it's being installed in a kitchen in a residence, then that would be the construction program. So we jointly did that with industrial and construction, and that's on the ministry's website.
And
But
I
thanks
see
for
Bill.
all the other great information from the other jurisdictions as well.
Great. I see Bill popped on. He gets to make a big announcement about what else we're doing about silica in the next presentation. So that's really good.
Well,
Good
I
news.
wanted to ask, I don't know if we have anyone from policy on from MLITSD. Just to your question about you know, cherry picking different parts of the standard. I'm not sure if our operations folks are able to talk about that. Certainly that would be a policy issue. So it depends on when that legislation was put in place, Kevin, that, you know, whether they felt that the CSA standard met you know, everything that we were hoping to have as far as enforcement here in the province, or whether they felt they had to be more prescriptive. And so they took points that had a standard approach, but then we also added individuality for here in Ontario. So we can certainly get back to you. It's a great question, right? We need to often ask why. You know, some of this legislation has been around for quite some time. And, you know, as standards upgrade, our legislation maybe doesn't catch up. So that's a very good point, especially, you know, as Cristina mentioned, looking at various points or various parts of the legislation and parts of the standard as part of that enforcement. So I know that's very governmentese.
If I could just add to that, you know, it's all of the elements of the standard are part of a respiratory protection program. So they need to be looked at collectively. They're all really important. And the other good thing about the standard is there's a good section in there on bioaerosols, you know, for healthcare workers and non-healthcare workers, using a controlled banding approach that takes the subjectivity out of deciding when to wear a respirator for COVID-19, for example. So it's a very good standard. I don't think it's utilized the way it should be. Thanks.
Okay, maybe that's something we can also add to our OI agenda, right? Something that we can look at is to talk about that with our policy folks. Thank you.
Great. And we are, again, so happy to see enforcement activity and these initiatives supporting the focus of OC illness prevention. And we know legislation is behind. We know it's the, you know, it's the minimum standard to follow. And what this day is about is sharing even better prevention practices, best practices, and giving you the most scientific research. So we know we have, you know, we know though those are the works in front of us, but we have to do it all, right? We have to be looking at updates to legislation and enforcing the one that we have. So thank you for all of the participation, and thanks Meg for sharing the Workplace Safety North. That's what this is all. The system partners are here, and to the speakers again. Ina is also sharing a great link. Again, thank you. And Tracy, Edward is asking, could schools be visited for any of these initiatives? There was recently.
So I'd like to say hi to Tracy. Hi, Tracy. Thanks for asking the question. Yeah, so for the initiatives in hygiene, they're across the board. So I would say schools are not excluded from the focus of the initiative. I know that we've probably talked in the past about the need for asbestos management programs. So they could potentially be on the radar for the hygiene initiatives.
Great. Thank you. And one last call for questions, and that we might take a little stretch break while we pull up the next slides, because we are in the.
She had a part two.
Oh, Tracy, thanks.
Yeah, there was recently a consultation on the industrial regs. Should we expect any changes soon? Again, that's kind of a policy issue.
Yeah. That's we're putting these guys on the spot. Yeah.
Yeah, no, good questions. Yeah, like a lot of the consultations on reg amendments, that sits with our policy shop. So yeah, I can only say that the information and feedback from our stakeholders is under review with them. So no changes right now.
Yeah, and we did invite some policy folks, but we really thought it was important to let everybody know about the enforcement initiatives that were going on. And you're about to hear some of the Occupational Illness Prevention Steering Committee driving some of that. And then November 3rd talks a little bit about others. So Kevin, I'll hold your question to the section on the strategy in just in the next speakers when Bill's talking with me. So any other questions? Excellent. Okay, well, we can say thank you again to Scott, JJ, and Fiona, and thanks for coordinating and consolidating this great info, and to Cristina, who made the effort, and Dr. Moody as well for kicking us off, and appreciate very much. And why don't we take just a 2-minute stretch break? I'll go off camera to allow for that and switch to, and then I'll introduce, well, our next speakers that I'm gonna kind of play with. So yeah, including me. Yeah, so to tell us more about Kevin's question. Okay, take care. Have a little stretch. It's important. And Jen, it gives you time to share the slides. Everybody all stretched and fresh for our next little section, and we're going to delve into the updates from the Occupational Illness Prevention Steering Committee. And I'm so happy to have William Roy join us as the Director of Strategy and Integration. I had to look it up, Bill, and I don't have a bio for you. And also, I just needed to thank.
Oh, did you not send one? Sorry.
Oh, that's okay. It was probably me. It's not you. But I didn't know really if Trevor was going to talk or you were. So I'm going to talk about Trevor because, you know, Bill and I look good because of Trevor. So Trevor King is a strategy advisor in the high hazards unit in the prevention office at the Ministry of Labor, Immigration Training Skills Development. He co-leads and coordinates the Occ Illness Prevention Steering Committee under the Prevention Works prevention strategy. He's a Canadian certified professional ergonomist, and he's worked as an ML ministry inspector and worked in research as a knowledge transfer associate and a research coordinator for the Institute for Work and Health, and has over 17 years of health and safety experience. So Bill, introduce yourself. Why not? You don't need a bio.
Sure. Yeah. Thank you for that. I didn't even know some of that about Trevor. So there you go.
I know.
Yeah, I've been with the ministry since 2004, believe it or not. Held various positions, but I'm currently the director of the strategy and integration branch in the prevention division. So we oversee the strategy, the annual report, and funding for system partners and research. So pretty passionate about this job. I've been in the prevention office now since 2016. So some may say I'm getting old and stale, but you know, I just absolutely love this work. And you know, it's days like this where we're able to do that knowledge transfer and show there's some impact in the work that we're doing that makes it so very special for me. So thank you for having me, and thank you for having this day.
Great. Well, over to you. I think you're first up for this slide. So just ask Jennifer to advance as you want. Go ahead, Jennifer, to the next slide. And I think, Bill, you're presenting first.
Yeah, absolutely. So this is kind of a refresher. We were overjoyed to be able to launch the new strategy, Prevention Works, and that was in July of 2019. So we've had a little bit of time. Unfortunately, COVID kind of ran into us all like a truck. However, the strategy remains in effect, and we've been doing some great productive work. And in the OI sphere, I've got to give absolute kudos to Kimberly, as you know, not only the co-host of the Occ group, but also, you know, you're just so extremely passionate and so you know, you're just so involved, and we just love it. You're a fantastic advocate. So enough shoulder padding. We so it's a 5-year strategy. We have 4 main objectives. We're currently doing a review, so that this may shift, but the first and foremost, the primary one is, of course, basing all of our work on data and evidence. And that may seem like, whoa, you know, no brainer. However, it really took the Auditor General to do a review of the system, which was in 2019, to couch, you know, the system is, although Ontario's one of the best jurisdictions to work when it comes to injuries and illnesses, nobody can tell us why. And so this strategy is finally an attempt where everybody's listening to work from that evidence. And so that's something that we've done using experts like you who are on this call to be able to identify where we need to focus on in OI, you know, the obvious divide between surveillance and prevention up front, and then, you know, case management and claims and longer latency diseases as part of individuals at the end of their careers, or maybe not necessarily at the end of their careers. So using that data and evidence is key. The next big pillar is knowledge and practices. So ensuring that when you're taking training or we're providing you a tool, which you're going to hear about soon, that there's reason behind it, that it's easy to use, it's easy to understand, it makes sense, it collects information, and that it's not just this one-trick pony, but that it's something that can be expandable not only through various sectors across the province, but also through various hazards or harms. The third is roles and responsibilities and moving to excellence. And so it's really trying to help those employers, you know, with their internal responsibility system, but also trying to say, hey, listen, we're now recognizing companies that are investing in health and safety, and you can get some monetary compensation for that. And so there's programs at WSIB, and there's also a program in the MLITSD. Small business is a priority, and it absolutely always will be, but we are thinking about shifting it down to be one of the system areas of focus, because it's a thread that weaves through everything, right? It's in every sector. It's about 95% of the businesses registered at the WSIB are 100 or less. 80% are 50 or less, right? So the significant portion of companies that are Schedule 1 are small businesses. And so how do we get to them? How do we get information to them? And then the 2 areas of system focus, the first is work-related mental health and violence, and trying to understand how we're going to deal with that. Obviously, that's been a big issue, and it's only increased throughout COVID. And then the big one, which we're doing a full court press, is occupational illness. And so we've invested in new surveillance. We've invested in expanding our occupational disease action plan, which is what we used to have under the old strategy, into the new one, which I think is, I'm skipping ahead, and that's the next slide. But also looking at a system review. So the minister asked, the WSIB is doing project management on a contract to review the OCC illness system in Ontario, to tell us, you know, where are the gaps, where do we need better transition or better information passing through the system to make everyone's journey that much better, to include, you know, surveillance up front, gathering information, getting exposure data, doing prevention work, doing research, ultimately leading to a longer, sorry, not a longer, but a better pathway through the system. Also linking in, I see that, is the strategy targeting the agricultural sector? So specifically, no. However, so the agricultural sector is something that we work with with our partners. So likely it's WSPS. And so we would have, based on the evidence. So if in agriculture, we've done 2 risk assessments. I think we did one in greenhouse fruits and veg, and we did one in greenhouse potted plants. But we haven't expanded that out into, family farms, larger farms. And so we did root cause and risk assessment in those areas because it's a good way to get employers and workers on the same page with their Safe Work Association and with the government. So agriculture is certainly something that our engineers have been looking at because of the multiple fatalities and injuries we've been seeing with equipment, stuff that's being designed, it's like Danish design, but it's manufactured here in a shed and there aren't standards. And so we recognize there are issues in that sector. And so, yes, there will be some focus absolutely on agriculture, but it's not explicitly, there aren't any explicit sectors mentioned within the strategy. It's more of a framework on how we're going to approach our work. Next slide, please. So as I said, this was the Occupational Disease Action Plans. What we did was we brought everybody together, researchers, scientists, WSIB, into the same room, and we decided, where do we need to focus? Where are the areas we can get the most traction? That is now transitioned into the Occ Illness Prevention Steering Committee. It's a mouthful. However, Kim and I are co-chairs of that, and really it's to bring the system together, look at evidence, say, where do we really need to focus that collective impact? So collective impact is where we're able to, hold on, get that here. So it's like having a common agenda, shared measurement, so having a common way of measuring the system, mutually reinforcing activities. So, if it's enforcement's doing a blitz, before that, we'll do some informational work with, or like educational work with our health and safety associations. And maybe before that, we work with the public health agencies, right? How do we make it so it's a continuous self-reinforcing or mutually reinforcing activity? Continuous communication, right? Let's not talk about falls week in May. Let's talk about falls as a danger the whole year round, as a, that consistent, continual communication to try and drive things down. And lastly, having backbone organizational support. So that's us in the prevention division, where we're able to provide that like secretariat support for the system to kind of get an overarching view of what's going on as we move things forward. Next slide, please. So we have very specific activities that we've decided that we want to use in order to achieve our mandate. So that's surveillance and research, obviously up front, followed by education and training, right? This all is aligning with how we're doing our strategic approach. Workplace tools, very important. Partnerships, and then ultimately the enforcement and regulations, right? Policy changes based on identified hazards in so it'd be like an OEL, right? Lowering an OEL because the research states that the current one you have is still too high. How do you bring that down?
And Bill, just remind me when we come back to this, when we chat, because really this whole knowledge mobilization of October is centered around this, right? We're going to talk about the surveillance and the research and the science. We're going to talk, we're providing some education. We're going to talk about the workplace tools, and the project that we focused on hits all of these, the strategic partnerships, and then that's why we wanted to bring you some of the enforcement, and then we will talk about influence regulatory change as we go through the weeks as well. So remind me to come back to this, but thank you, Bill.
Okay, next slide, please. So part of doing this in an evidence-based way, and I don't know if there's a delay.
Oh, Jen, there might be a delay.
Yeah,
next
that's fine.
slide. So
the next slide coming up will be a logic model. So what we've done is, we've actually taken a framework for measurement from like the Treasury Board of Canada as an example. They use it on how we will measure performance, how we'll do evaluation of the work that we're doing. So we start, obviously, we identify what are the needs, like what are we trying to achieve, what are the activities. I'm trying to do this while
Jennifer, are you having trouble? Oh, thanks. Thank you.
It worked? Okay,
Yeah.
sorry, I was multitasking. So
Yeah.
you might not be able to read these. Hopefully you can. It's very small. But starting with activities over on the left-hand side, right? You've got an ultimate theory of change saying, if we do the following things, we believe that we will achieve the following change, right? And so those are the bigger buckets, like those are the big objectives of the strategy. So here we're looking at very specific activities. So surveillance and research, training and education, the tools, the partnerships, and using that evidence to support policy change and enforcement, right? So it's the activities align with those 5 ways that we're moving forward. The outputs of that is that we're looking for sector level exposures, right? We're going to get that from our inspectorate. We're developing how we're going to figure out how do we get that? How do we get that information out? We also have the surveillance website. We've been talking to Alberta, Manitoba, and BC about sharing their exposure data. The OCRC, they've got an individual on staff, I think it's Tracy. Sorry, Tracy, if it's not Tracy. But she's very familiar with the occupational safety and health, like OSHA down in the States. And they have millions of records on exposure data. So if we're able to draw that data in and identify, at least to use it as proxy data, similar manufacturing processes, what is the information? And then, that will even help us to identify where our gaps are. So there's a lot of work that we're doing in this first bucket of surveillance and research. And then as we do those outputs, we expect some outcomes, right? What is the impact itself? So we decided that the system delivers evidence-informed education, training, and tools, right? So it's knowledge mobilization. You take the research, you're like, oh, this is really important to know that exposure to cutting silica can cause silicosis, right? And so you translate that knowledge. I know that's very basic, but I'm not actually a KPI person. However, in essence, that's what it is, right? And so that's an immediate outcome. People will know tomorrow. And then the intermediate outcome, as we move further and further out, we're hitting that ultimate long-term outcome of the reduction of the amount of individuals diagnosed with silicosis as a result of a workplace exposure, right? So that's you draw through the logic model. So, I won't swear, but Ron Kleski was the former CPO. And he always said, it's like the movie The Martian. How am I going to grow potatoes on Mars? Well, you have to science the S out of it, right? Like let's throw science at this. Let's follow logic. Let's follow the evidence and actually make some impact that we can measure. Next slide, please. Sorry, and I know I'm probably going extra long. So year 1, accomplishments. It's been such an exciting year. So yes, we did the upfront administrative stuff. We have a terms of reference. We have governance. We understand, where it is that we're going to focus. What are those priorities? We wrote out that logic model, identified what do we do? What are we looking for as far as outputs and outcomes? Each of those 5 pillars. But then we've improved by having these meetings and collaborating the surveillance information that we have, work that Krosh did on research on diesel emissions. Next slide, please. Stakeholder participation. So we had the OD review that's currently going on. So this is something, as I mentioned at the front, we're really investing in OI. So we just actually had our meeting this morning with this group, with Matt and the team, with Dr. Holness, Dr. Lynn Holness from St. Mike's, talking about what does this look like? What's the landscape? Where are the holes? Where are the bottlenecks that people are falling into? Identification of the new collective impact program. So this is the big news. Kim worked for, it's 3 years now for it, maybe 5. We saw that British Columbia was doing some great work gathering information, very specifically on Victoria Island. VICA had been doing some work. No, I'm confusing VICA with the tool. Sorry, so it's BC.
UBC,
Safe Work BC, UBC, had been doing some great work on surveillance of silica. And so starting to collect at the workplace exposure information. And so they developed the tool. And this tool is something that we're going to be talking about, and we're bringing it to Ontario. And what's so exciting about that is there are other provinces as well that are getting in line and we're getting traction. And, you know, the long-term vision is to have Canadian exposure data related specifically to silica that looks at exposures. It provides you with, you know, the next steps, like the plan on how to work safely. It talks about what the exposure is that you can expect based on the tasks that you're doing and what the conditions are. So Kim's going to do a deeper dive into that. But you know, that is something that we came together and said, there is a tool that exists. We can do this. We can partner. We don't have to reinvent the wheel. It's based on evidence. It has scientific methodology behind the creation of the tool, right? It's based in evidence. So there's a need for the program here. Obviously, we just heard that you've got Australia and the US, you've got, or maybe it was UK, cases increasing of silicosis. Like, this is it, right? Where do we need to put this tool? Who needs this tool in front of them? Where normally it was the slab guys, now it's a prefab, right? Manufactured fake stone. And gosh, I think you said 95% silica containing, like that blows my mind, right? So you think of a new worker, silica has been, you know, designated substance for years, like everybody knows, stay away from it. But a new worker doesn't know that, doesn't have that information. And so we're seeing increases in exposures again, where it doesn't make sense, or at least it shouldn't make sense because we have a lot of legislation. And so how do we do that? How do we provide that information right to the front line? This, as Kim said, this follows our logic model, our theory of change. There's performance management there to understand how many people are using it, what the exposure is. It's building a database. So it's very exciting, absolutely. I think the next slide actually just says SIlica Control Tool, and I'm supposed to hand it over to you, Kim.
Thanks.
There you
Thanks.
go.
Thanks, Bill. Well, we're tag teaming, so don't go anywhere. And Trevor's here with
absolutely.
us too.
Yeah.
Okay, so yeah, no, really just wanted Bill to make that announcement because though we've known it as an internal team for a while through the system partnerships, you know, the ministry's funding it for it to come to you at no cost to everyone to use. So this is groundbreaking to me. Like we have worked with and if you look back in our archive from even this October event, which follows ODAP and the evolution throughout the years, we had Hugh Davies, we have Melanie Gormaning, the developers of this, talking about it. And then we met afterwards, and you know, so we're always, when we provide you this latest and greatest, hopefully 3 years from now, you know, we are you know, when we talk cytotoxins, we're going to be doing something about that. When we're talking diesel, hopefully we influence change there. And now we're able to show that progress. And you can go back in the archives and have the researchers came to talk about the tool. And now we're implementing it in Ontario. And again, at no additional cost to users. And you can go to the next slide, Jen. We are we're doing this again, just giving context. And it includes all of the buckets, activity buckets that we created, which are not dissimilar from the original, just kind of, you know, shortened and, you know, put into, you know, with the research behind it and the data and aligned with the strategy. So everything is sort of planned and aligning nicely. So it does help us. It's going to help us with, as Bill mentioned, surveillance and research. It educates while you use it. But the big deal is, and you can go to the next slide, it's going to reduce silica exposure. So let's stop. I mean, it's great that we started with the enforcement. We need it. We know we need policy change. We're driving it, but we know silica hurts people and gets them sick and kills them. And we're going to reduce exposure by utilizing a free tool. And we're helping you help yourselves. We're empowering. And you know, I always get nervous when I open up these sessions, and I of course had all these things to say and didn't say them, but one of my goals in life is to make everybody an occupational health and safety professional, and COVID has allowed that I hear it in the grocery store. They're all talking risk assessment, people that would never, ever have that vernacular. And now we want to bring that to long latency illness, right? That scale that learning and take that momentum. So these, creating these tools to help people help themselves. Tool is not replacing occupational hygiene. I also would like to put myself out of job, but I also know that would never happen, because we need assessment. We need the people that have the funds and the resources to be doing. It's not replacing any of that. It's the shop, and you can go to the next slide. Oh, you're there, Jen. You're ahead of me. It's not replacing occupational hygiene. It's geared toward those that would not ever do anything about their silica exposure, the small business, the mom and pop shop, the construction company that can't do exposure monitoring before they change their work environment. They're doing working drilling for a moment, and they're mobile, and they can't get on top of that. So we can talk claims drives me nuts, because we know, again, that people aren't claiming their silica exposure. They get sick much later on, and that's part of our issue that we are also working on, the OC illness steering committee. So if we could stop talking about claims as data, we know that it's not, and we can focus on the CARICs and OCRC telling us that 100,000 workers are exposed to high levels of silica every year, which means they get sick. 200 lung cancers can be prevented if we reduce exposure to silica. Well, we're going to do it. And if we can't do it with legislation, we hope to. We're still working on it. By reducing the OEL, we'll do it by helping, introduce this tool along with educating on a whole bunch of other stuffs. But that there is a cost per claim that's high as well. Even though we know the numbers aren't correct in the claims system, that when they do get there, it's a very high claim number for a silicosis or silica exposure, between $150,000 and $200,000 a claim, rather than your $2,000 or your noise claim, for example. Not to minimize, but that's what people like to hear, the business case. For me, it's more of a human case, but it's worth letting people know about. And these workers, like I said, in the construction sector are vulnerable. They're moving quickly between sites and tasks. You can switch slides, Jen. Between shifts, so they're really mobile in terms of their operation, and can't really do the monitoring that they could, and this data will help with that, and then it'll increase our data in the long run. So there is a high need in this area to do something about it in many areas, and hopefully silica, you do have to narrow. We're not saying it's the only issue the OC illness steering committee is working on. It goes to Kevin's statement and question that I'll let Bill address later. We are focusing on long latency illness, but we'd like to hear from Bill about what's happening with infectious disease, as it kind of wasn't part of our scope here, as we focused on long latency. But tasks where workers are at increased risk of respirable crystalline silica exposure are like drilling concrete, chipping concrete, mixing and pouring cement material. And yeah, it's difficult to ascertain how many employers know and understand the requirements laid out in the Act. We talked about the enforcement strategy and the initiatives, but we know that a lot don't have the knowledge about that they even need to be doing some of this stuff. So we want them controlling the hazard, I guess, in priority. You can skip to the next slide, Jen. So I already talked about this one. So that it would, and so did Bill a little bit, but we had Hugh Davies and Melanie Gormaning previously back in 2019, I think it was, or 2018, after they implemented the tool in 2017, and they've been continuously improving it. The data in it is based on a linear regression model, and it's got 4,000 users already, and we're bringing it here. So we're working on the work plan to do that, and we need your help. So I'm looking for feedback shortly from our audience on ways that we can make sure we promote the tool. But it has excellent user feedback. We did a pilot. I did on today. We wanted to have a worker's voice in every session, but we couldn't. That just didn't work out for scheduling purposes. So on November 24th, please sign up and register, because we will have the user feedback person part of the pilot that wanted to share what they had done with the tool here in Ontario that we had put on. And so you'll get some kind of a user experience with the tool on November the 24th. Go ahead for the next slide, Jen. So basically, we want to increase Ontario construction employers' knowledge of silica hazards, but more importantly, we want to increase exposure risk assessments in the construction industry, but ultimately reduce the hazardous exposure of silica to construction workers. And our logic model mentions that we are, while using this tool, we're going to collect additional data on the prevalence of silica exposure, and also reduce exposure in general. Sorry. And the next slide, Jen. I did want to say kudos to all of our Occupational steering committee. I usually have a slide with all of our logos, and I forgot, Trevor, to ask us to input it, because I think it's visually pretty, to what Bill talked to with collective impact. And we try to have every system partner, and we had links to their webinars because they hit different sectors. Everybody has a different audience, and we need to get the message out there to across all sectors and to all audiences, unions, worker reps. We need the employers, public health. We need the trades. We were talking about how we want to get the skilled trades training to join our Occupational steering committee. As we need to get this tool out, no matter in lots of these building partnerships and cross sections. But I did want to specifically thank the BC Construction Safety Association, the Infrastructure Health and Safety Association, CREOD's helping us, as well as U of T, Victoria, and Lynn with evaluation, and CCOHS as well, who we are looking at going national with it as well. You never know. So they're helping us with messaging and marketing once we get there. So next slide, Jen. So I just wanted to show you what it looked like from a pilot perspective, but no reason to take up time doing that, because again, you're going to get the user kind of experience and feedback from the pilot on November 24th. So just the next slide. So that's some examples of what a screenshot would look like. It's very user friendly. I can't wait for everybody to get playing with it. Bill, our date, when we're it's going to take us a while to do all this magic, right? It's not going to be in the toolkits as of tomorrow. So we're aiming for, can you give the date from the work plan again, or Trevor can?
Yeah, Trevor probably has more detailed, but we've started to reach out with BC to finalize, getting a contract with them. Part of that is going to obviously be support. It's going to be skinned for Ontario, right? And that's a big key as well. This is something for us. This is something for our legislation. So maybe Trev, unfortunately I've been called to a meeting with Joel. So I have to jump off. I did want to just speak quickly to Kevin's question about infectious disease. So that was something that we had contemplated, certainly as COVID hit as a group. And in talking with our provincial physician, Dr. Nick, as well as Craig Lowry, who's our hygienist, infection prevention control expert, they felt that it was probably best to keep that as a Ministry of Health thing, right? So there's influenza, there's all kinds of different infectious disease that are going out. That's not to say that an employer should not have some form of IPAC, right, as part of their policy and program. So that is something that we've been talking with them about, is how do we get that information out there? That's something that we're adding into the building, the safety plan builder app that was stood up as part of COVID as well. I know you can certainly make an argument, that's great, but when the public health crisis comes into the workplace, then the workplace needs to control that. I get it. So, absolutely, we're regularly talking with Nick and his team. We're more and more, we're able to get to the different tables at Ministry of Health and apply that occupational lens, or have a representative from the occupational health and safety side. That's something that we feel was sorely missed during COVID, that a lot of these action tables that were stood up only had that public health lens. And so we were always, at the back end trying to say, yeah, but work is different, and here you go, these are all the guidelines. So we want to, I think to Kim's point, a lot of people are now more aware of their rights, responsibilities, and, being safe at work is something on top of everybody's mind. So we're trying to use that as momentum. So although it's not explicitly as something that the OI group is looking at, we have had the discussion. So, I would be happy. Unfortunately, I do have to go. I apologize sincerely for that, everyone. But I'd be happy to talk about it. And obviously, I think as the OC illness review gets done, as our group continues to look at what we need to focus on next, now going a little bit of a tangent, we did a strategic foresight project where we looked out to 2035, and it was there, right? It's infectious disease is there, the working remotely is there, solar exposure is there, right? The environmental impacts that are happening, we see all over the place, especially for people that work outside. So it's something that we cannot ignore, and I would love to be more ready for the next event as opposed to having to react again. So we're thinking about it, certainly with Joel being a doctor, that helps too, that he's on board with that. So again, I know I get it. It's like a political kind of answer. I wish I could just give you, say, yes, it is. Absolutely, it should be. But we've gone through some policy and legal and physical physician discussion to get to the point that right now, no, it's not.
Okay, thank you.
Thanks, Bill.
Okay.
And thanks for
thank
coming.
you, everybody. Yeah, absolutely. So Trevor said he's ready and willing to step in. So you'll get to see Trevor, everybody. He got a fantastic intro, and great to see you, Kimberly. And thank you, everybody, for attending.
Thanks
Adios.
a lot. Cheers.
Stay safe.
Come on over, Trevor. Join me. So Judy, this is an excellent question as well, and I actually want to invite questions, but also we're looking for feedback. So we're going to bring this tool to Ontario, and you'll see on the 24th, but you can go back to the archive. Melanie's demonstrated it before, but you're putting in, it's really focused on construction right now. We're hoping that's part of our scaling as well. BC is also close and has been looking at it from a mining perspective, also from a silica countertop perspective. It just needs more data to be able to work. But as a construction, you put in, what you're doing, and it will spew out and what it's estimated, your estimated exposure to silica might be, and then you add controls, and it shows you the corrected exposure, and BC accepted this as an enforcement tool, as a control plan, and so we're moving in the exact same way. But how can we bring it? What do we need to do to make people want to use it? It's going to be free, so we're looking for feedback from the audiences. If you have a brother or a cousin working in construction, what would help these users use a tool like this. It's fairly simple. We have, you know, in the pilot, we have promoted it to unions, to labor, to small business, and hands-on training. Excellent, Judith. Yeah, super. Though that's and that's going to be part of intros. It is very user-friendly and gives you kind of explanatory as you go, but that's really, really good input. And I just want to make sure I covered your question. So you'd like to see a focus on enabling business to do their own quantitative assessment and hands-on education on how to conduct an evaluation if workers are at risk. So that's exactly what this tool does, but specific to silicon construction. But thank you. And hands-on training is a good, is good. Yep, Kevin.
Sorry, I just wanted some clarification. In BC, you actually have to have log on details to get and use the tool. Whereas in Ontario, my understanding is this will be freely available to anybody in the public. So maybe somebody in South Africa perhaps could get in and use the tool as well. Is that correct, Kimberly?
I don't know yet. Yeah, we're not. It's not coming to us until 2023. How you'll get in? It will be free access, but will you need to put in some type of ID to show that you're an Ontario construction employer? Probably.
Oh, sad. Okay, thanks.
Yeah, I mean, I think the part of the reason for that is when talking about just the technical support for the tool, it's not that they're looking to profit from the tool at all, but they just need a certain amount of funding to support the tool on the back end. Yeah. And so I think that when we're looking at the numbers, we can be very frank with you. We're looking at, well, based on things like Statistics Canada, how many construction employers are there in the province? So potentially how many users would we have? And so we're working that out at a price per user sort of model. Best case scenario, everyone's using it, everyone's accessing it. But yeah, it's a really great question. It's something that we would have to work out with the technical team in BC.
And Kevin, that's what we are trying to work on with CCOHS as well, bringing it nationally. So the Ontario might be another type of Ontario-wide pilot to be, for instance, and then it could come, CCOHS might look at bringing it nationally, which would maybe be the freer access that you're talking about internationally, right? That's the avenue for that. So first it's like they're making us pay because it's going to be very technically supported in the background, you know, for user questions. And so there's a by number pay system that the ministry is bringing, but they're not going to do that for the world just yet. But if we do it for Ontario and then we look at CCOHS providing it nationally, then that'll probably be another path towards that.
Thanks. So I'm just thinking about like putting on my workplace health without borders hat. You know, there'd be a lot of countries, developing economies that would really benefit from this. But I can talk to you about that offline. Thanks.
Yeah, it's really.
Oh no, we would love it, but yeah, it's just the logistics of it for sure. Lawrence, yes. Oh gosh, I don't know. I can't make any promises there, but that's absolutely right. When you get something like this, it's complicated and mathematical, and it's got a lot of back end, and it needs support, and then the support staff would be. But you are so right for sure. There's no doubt about it. That would be needed. So the infographic that we're working on, we are looking at as part of the industrial enforcement that Fiona was talking about. And a lot of those are starting to be available in multi-languages, as we know, so needed for new Canadians. And, you know, but a tool like this to be available in all languages is absolutely a good idea. It won't be part of this project, but it's needed.
Yeah, it's baby steps.
Yeah. Any other ideas on how to get Ontario construction companies using the tool and help us bring it and market it, or questions for us on the Occ-Illness Steering Committee work?
Yeah, I think we're even thinking about how best to reach these users, right? And like, 'cause we have our traditional channels that we
Yeah.
always go to. If there are other areas that we should be trying to connect with, other key connectors, that would be greatly appreciated. I see Kevin's hand.
You just another question. In BC, the exposure limit for respirable crystalline silica is 0.05, and in Ontario, it's 0.1. So, you know, it might show red over there, but it'll show amber green here, which could kind of be a bit of an issue as well. I just thought I'd raise that.
So yeah, the tool, I can speak to this quickly, and then Kim jump in if I'm saying something wrong. The tool is meant to be suited to the jurisdiction that it's being used in. So Ontario will use Ontario's limit. I think the exposure limit that you're seeing there on the screen is Ontario's limit. The action limit is sort of what you're hopefully striving for, like the safer limit. And obviously that number will change if there is a change in the regulation, so that they can update that pretty quickly on the back end.
You can bet that I am actively
all
working all the time to make sure that we don't put out a tool that doesn't get itself up to the rest of the world. So, or with many other jurisdictions. So thanks for that, Kevin. Yes, we hope it's a benefit when it comes out that it's a compliance assistance tool to a lower exposure limit. But, you know, it will reflect the jurisdiction that it is, but we are all working towards that as well.
Great comment, Lawrence. I think reaching out to some of the gatekeepers of health prevention. Yeah. I mean, that's one of the common themes for the committee. We're trying to find out how to better connect with these individuals, educate them about occupational illnesses. There's, Kim, as you said this morning in our meeting, there's very few family physicians who have this education and background, and then there's very few actual occupational medicine physicians out there in Ontario. But that is a great idea. I think as we're connecting with them about OI in general, we can show them the tool, especially if it's something that's quick and easy to use and easy to learn, like this. They may be more ready to share it with their clients.
Yeah, the committee just had a meeting with the Occ-Illness review this morning, as Bill alluded to, and it was such a gap that even, you know, the ODAP was working on having the electronic medical, having physicians even know about occupational illness, you know, and asking about where you work. So having the physician toolkit, and we have that on Prevent Occ Disease as well. And so thanks, Lawrence. We know that's such a gap just from physician education in general, and then having more occupational physicians, and then having them, you know, share with their clientele. Dan, also connecting with regional health networks. Perfect. You guys are helping us build the strategic partnerships we're looking to do as well. We do have public health at our table, but you know what, Trevor, we got to follow up there too, because you know, these great comments are making, you know, we want to make sure we're getting, you know, the input not only at the meetings, but the push from all those partners to share when we do. So it's really good, really good.
Absolutely.
Any other questions or ideas for us? Holy cow, I thought we were going to be done like 2:30 today, but we sure because we had planned to have a whole other section that's moved to the 24th. So thank you, Kevin. Yes, appreciate that. I heard so Kevin was talking about the tool at the South African Institute of Occupational Hygiene Conference. So never know, they might be a new client for the tool as well. So BC, you know, has been very open to expansion of this. When something works, why reinvent the wheel, right? So how can we control the person who's using the tool is not subjective to his or her beliefs? Okay. Yep.
Yeah, that's a really good point. I mean, I don't know if you're getting at sort of a delinquent employer, maybe, or maybe it's just an employer that doesn't actually know that they're ventilation system
Yeah.
is not operating efficiently. The tool is not that sophisticated, unfortunately. It really is meant to get those, I think Kim said this before, those who are doing nothing about this issue right now, who would perhaps like to. I think at that level, yeah, there would need to be a validation check on the controls that are being implemented on something like that. But it's an assessment tool. It's a guiding tool. In terms of Ontario and how we'll approach it in terms of enforcement, I think that's still being worked out internally. But for example, I'm fairly certain that a ministry hygienist, if they were still questioning whether or not the reported controls are efficient, they would investigate further. But at least this is a great first step to assess the risk and potentially put these controls in place.
Yeah, and it's just conceptually, like I said, when we're helping people help themselves, and when we're looking at controlling exposures as a step, you know, in immediacy when we know there's issues, and then, you know, you can go back and assess, and it's really targeted to those who wouldn't be doing any of this, and that's, you know, it's not the gold solution for when you can have resources to do appropriate assessments and have, you know, consultants and proper exposure reports and then suggestions for recommendations. It's really for those who wouldn't be doing anything at all. And thanks, Dan. So yeah, any other questions or comments? Or Jen, you can put up the website again, if you don't mind, as we close. And I have to thank Trevor publicly. I thank him all the time. I tell him he can never stop working with me. And yeah, great, Judith. I'm happy to see that. It will take time. So, you know, it's way back at we did the pilot. And Trevor, did we answer this? But we're looking at the work plan now.
Yes, we're hoping for an April, like the new fiscal year release. Working through those logistical details right now. As Bill mentioned, we're hoping to meet with BCCSA to talk about the back end support piece and contracting. But ideally, if all goes well, it would be April. But yeah, ideally early in the new fiscal year.
Yeah, and things are always, you know, there's always hiccups along the way with that there, and there's a rebuild of the tool that has to be made to make it specifically, want to really match it to the guidance documents and the, you know, the code for SIlica, and really make it Ontario specific, and hopefully influence that along the way, as we mentioned with the OEL itself, the occupational exposure limit. But so yeah, just thanking Trevor and Bill and all of our speakers from, so, you know, when we talk about our activity buckets, but we focused a lot today on the you know, enforcement and legislation pieces, and we're going to continue that next week with influencing change, because Kevin gets to come join us again with Crosh and the United Steelworkers, because again, we want a worker-focused science and prevention theme throughout, and you know, show some of the work they've been doing to influence change to the exposure limits with diesel. So hope you can join us next week at this same time, same station, and the 3 weeks thereafter, throughout this October event. So we're going to sign off and give you a few minutes back in your day to stretch again. Stay well and healthy, and thank you for joining us.
Thanks, everyone.
Cheers.